Hi, I'm Mahmoud Sabra. I will be discussing about two cases where an individual has sex with a partner without informing them of their current health status, specifically being HIV positive. Now, both cases are similar, but the case of RV Sinyanga was in the 1980s. New laws over time are constructed to back up any flaws in previous laws that have been challenged. Among the first cases of sexually transmitted diseases was RV Sinyanga. Charles Sinyanga is a Canadian male who was on trial for transmitting HIV to three other females in London, Ontario in the 1980s. Sinyanga did not disclose his HIV status to his partners and therefore knowingly transmitted the disease to several of his partners. This case was a very interesting one because he won the trial, being acquitted of all charges against him since his actions at the time did not violate any laws of public nuisance, negligence, causing bodily harm, aggravated assault, or fraud. The result of this case brings up many concerns regarding patient responsibility and in turn makes us question the actual consequences of failing to uphold the patient's duties for public health care. If no penalties exist for failure to disclose your health status, then why would you bother to do so and expose yourself in the first place? Fortunately, when another case with similar offenses occurred in 1992, which is the case of RV Courier, the ruling of the Sinyanga case was brought into question once more. Courier committed the same actions as Sinyanga, but this time the jury overturned the Sinyanga case and successfully convicted Courier of aggravated assault and currently failure to disclose HIV status to a sexual partner is now considered an act of fraud and is punishable by law. Recently, new laws have emerged to challenge the previous law, which was that the criminal law requires people living with HIV to disclose their HIV status before engaging in behaviors that risk transmitting HIV. This would be applicable to all persons infected with HIV, regardless of the severity or condition. This was challenged recently by the case of Klato Mabior. Klato Mabior had sex with 9 women, including a 12-year-old girl, between 2004 and 2005 after being diagnosed HIV positive. Klato Mabior took antiretrovirals, lowering the viral load that he was harboring. Klato had sexual relations with many women and did not disclose his HIV status with them. It would then seem that Klato would be convicted for sure, but the catch in his case is that the HIV positive partner needs to meet two criteria for for them to be absolved of any charges. These these two criteria are the carrier of the virus has to have a low viral load and a condom must be used during sexual intercourse. Clato still needs to appear before court because of the cases where he did not use a condom still renders him open to prosecution. In time, Mebior was sentenced to 14 years in prison after being convicted of aggravated sexual assault in 6 of 9 of the cases. But he was acquitted of the remaining 3 because the judge ruled that his low level of HIV and the fact he wore a condom negated his duty to inform the woman. The important thing to take away from this case is that Clato was finally convicted in the end due to the fact that he was unable to uphold his duty as a patient, providing full disclosure to his sexual partners about his health status and warning them of the possibility of transmission. Therefore, subjecting both himself to jail time and deportation back to Sudan and his partners to possible transmission of HIV. Now, overall, it is very important that when a person is diagnosed with HIV or AIDS, that they inform both their family members as well as their sexual partners about the presence of the disease and to take steps towards dealing with this newfound information. It is also important to remember that when visiting a doctor for HIV, the doctor will do another HIV test to confirm that the individual has that disease, and personal information will also be collected and sent to the public health, where a database is kept of people who have been infected with HIV, and the information that is collected are the person's name, date of birth, gender, and what infection, and contact information. The database has helped the government track down people with the disease as a preventive measure to limit the spread of the public. Now, There are two questions that I've provided which are related to this presentation, and they're good to discuss about. Is it ethical to mark those who have the disease and expose their condition to the public? And do you think it's fair that the individual with HIV doesn't have to inform his partner of his condition if his viral load is low and he or she uses a condom? These two questions are important questions to be considered, also considering the law. Please share your thoughts and discuss what you believe is not just ethical but safer for the public.